although the community assessment was done in Honduras, it started way back in the fall semester, and looking at the previous community assessment and the questionnaires and the information gathered from that. And we took that and created our own version of it so that we would be able to analyze it and compare the community assessment done in 2024 to the one that was done in 2008. And so it took a couple of weeks, but we were able to collaborate with other physicians and pharmacists, as well as the public health team, to create a really great community assessment so that we would be able to go to Honduras and facilitate it.
My applied practice experience last semester was on how psychological distress is addressed in faith-based communities. And so what that mainly consisted of was looking at these faith-based communities, what resources are there, and what kind of resources could be implemented to better address psychological distress in college age / young adults. And so that experience really prepared me, because we kind of talked about it some with the interprofessional team there, but the social determinants, like, it's not just the person at that time, but it's also many other factors that affect an individual and that should be incorporated when it comes to addressing whatever the concern is. And so the applied practice experience helped me to get that objective view of looking, again, just objectively outside of just that one concern, but what are some of the other things that contribute to the concerns that we see. And so just having that experience of surveying, of creating a survey tool, administering it in an effective way, and then analyzing the results has really helped me and made me excited and helping me feel more equipped to do this community assessment in Honduras.
So we were able to input the data into Qualtrics, which was our survey database that we used. And so we collected the data, or the surveys via paper. So we went into the homes, asked the questions, and wrote them down on paper. And then once we were back at the clinic, we were able to input it into the database.
It was fun to do that at the end of each day, and I think it was worthwhile to do it as we were collecting the data rather than having to input it all at a later date, and it can get overwhelming to do that. So I was appreciative that we could get some bit of service to go ahead and implement it as we were administering the survey.
Last question, because this is the focus of this particular Lyceum, is how do you feel these community-based experiential learning activities and projects, where is it taking you to in terms of what you're thinking you want to do in public health or in your future public health careers?
And so I'm very interested, or highly interested, in epidemiology, but this trip to Honduras allowed me to understand the importance of collaboration and collaborating with other constituents and the community as well. At the end of our brigade, we had a big meeting with the community partners in Guachi, and we were able to talk to them about what the community assessment was and get some ideas of things that they wanted for the community, and ways that we could help them out also. And so this was an eye-opener. It connected me back to my classes also here about mobilizing communities and community partners, which is one of our core functions of public health. So it was just it connected and went straight into my classes really well.
Yes, it's the same for me. There's a lot of interprofessional opportunities here at Wingate, and so I've had an opportunity to be a part of the Interprofessional Health Club, as well as the interprofessional events that are required for some programs. It's not required for my program, but I still do prefer to attend. And so I think having those experiences, as well as this experience in Honduras, has helped me to see that I enjoy interprofessional health work. I really enjoy surveying health systems, whether that's here in America or international health or global health. So just kind of taking an objective view of health systems, analyzing it and implementing better practices. I really enjoy that. So whatever that looks like later. I'm not exactly sure, but overall, that's what I enjoy. It's just interprofessional work and exploring health systems.
Any last words?
No, I'm just really grateful for the opportunity. That's one of the great things about Wingate is just that it is a really close-knit family, and sometimes we can take for granted just the opportunities we have. And so I just want to just take a moment to say that I'm very grateful for the opportunity to travel. This was our first time out of the country, and even again, like a medical or research trip like this, so I'm just very grateful to have attended.
I agree. I agree. It was an amazing experience, and we were able to connect not just within Wingate, but also with other professionals outside of Wingate, and get really close with them. And so it was really great for networking and connections, and just it was just fun.
Great. Well, thank you both so much for sharing your experiences. I'm sure other students will now have a better understanding of what it means to move from classroom to workforce. Thanks to both of you.